everyone. Thank you so much for joining us. My name is Christian Howard, and I am the CEO and lead therapist at Gracefully Fulfilled Counseling and Coaching Services. We provide a transformative, culturally competent therapeutic experience to rebuild lives. Right now, we are offering virtual services to DC and Maryland residents. We provide individual, couples, and family therapy. We will now be adding groups later on this year with groups of 10 or more individuals. Today we are here to talk about anxiety and how it correlates with trauma. During the pandemic, I am more than sure a lot of us are dealing with anxiety, and all of our triggers have been exacerbated under this pandemic, but I am going to give you some skills, some coping mechanisms, and to let you know how you should seek therapy. So now we're going to talk about anxiety. Anxiety, we all have it. We all experience it on a day-to-day basis. A majority of diagnosis, when a therapist, before they can even diagnose you, it has to impact your daily functioning. That means your job, your home life, your family, things of that nature. So just a little bit of anxiety, like I had a little anxiety before I started this presentation. All you have to do is do some deep breathing. That is extremely normal. But when you are diagnosed with an anxiety disorder, which there are multiple anxiety disorders, from post-traumatic stress disorder to obsessive compulsive disorder, to even like agoraphobia and things like that, it's an excessive amount of worry, fear, and anxious feelings that impact your daily functioning. So some symptoms, like when you're having an anxiety attack or a panic attack, it can be fatigue or hypervigilance, or like the racing thoughts, the sweating, nausea, insomnia, lack of concentration. All of those things are symptoms of anxiety. Now I'm going to talk about how anxiety and trauma are correlated. Some anxiety can be triggered by predisposed childhood trauma. The therapist that I am, I have a theoretical orientation of psychodynamic. Psychodynamic therapists believe that anything that impacts you in your childhood can impact your future. In order for us to kind of control the present, we need to understand both patterns, your patterns from your childhood and those negative behaviors that you learned that you have started to cope with. We want to understand those patterns so we can change them and put in some more positive, healthy coping mechanisms. With that, we understand that an overstimulated nervous system can cause anxiety, panic attacks, and hyperactivity. Our system becomes stuck. Our nervous system is actually what controls and self-regulates our emotions, our responses, how we respond to different behaviors. Like if a dog barks at you, or if you were someone who got into a lot of fights growing up and now as an adult you carry mace or pepper spray, that is actually a response and some anxiety due to your childhood trauma. So with that, that's how anxiety and trauma is correlated, and how therapists want to understand and comprehend the different patterns that you experience as a child, so we can change those negative coping mechanisms and implement some more healthier boundaries. When getting treatment for anxiety, treatment looks different for all of us. The most effective therapy when treating anxiety is therapy along with medication management. You do not have to take medications. I honestly that's not my go-to. We will look into your environment, your biopsychosocial first before looking at medication. Only a psychiatrist or nurse practitioner can actually prescribe medication. When you're seeking out a therapist, make sure that you utilize the 15 to 30 minute consultations. Those are free. All therapists should allow you to have those consultations. Even after the first initial 50-minute session, you can seek a different therapist if that is not a good fit. In order to treat anxiety, you want to make sure that there is a safe relationship. So the rapport building and gathering of information is critical at the first initial appointment with a therapist. When it comes to the medication, some of the medications that are very useful for anxiety are selective serotonin reuptake inhibitors. Those are like your Zoloft, your Lexapro, and your Prozac. Those are the commonly known medications that are given out to treat anxiety. But we also have antidepressants, sedatives, and your nerve pain medication. And if we think about the last slide, we talked about the nervous system and how it has to self-regulate in order to help with the anxiety. That nerve pain medication can also assist with that. We're going to talk about the different therapeutic modalities that can be used to treat anxiety. So the first one that I'm going to talk about is meditation. Meditation is extremely helpful because it helps regulate your nervous system. So with meditation, you can do the sound healing, or like the controlling of your breathing, or yoga. Yoga is really all about controlling your breathing. So right now, I'll do a breathing exercise, and I would like you all to do it with me. It's pretty simple. All you have to do is breathe in for 7, hold for 7, and then breathe out your mouth for 7. So when you breathe in, you want to inhale through your nose and exhale out through your mouth. So I'll begin. Ready? Go. 2, 3, 4, 5, 6, 7. Then you want to hold. So you want to do that multiple times. You want to breathe in with your nose for 7, hold for 7, and then breathe out for 7. And that really regulates and help with the heart racing, controlling of like sweaty palms, or even like just like controlling all of your nerves. It actually helps clear your mind as well. And so like the breathing exercise is extremely important because it regulates that nervous system. The second one is the most and it actually can work for any disorder, and it's cognitive behavioral therapy. That's where it's going to be the most effective and also evidence-based. With this, we want to change, it's all about changing the negative into a positive, whether it's the cognitive distortions or like your behaviors. We want to make sure that you're changing any negative thinking to a positive. They say that 60% of the time our brain automatically goes to a negative thought. So if you're like looking in the mirror and you're sitting here telling yourself that you're not pretty, or if you're, if you have social anxiety and you're about to go out and you're like, nobody's going to talk to me, they're not going to like me, things of that sort, we want to make sure that once those thoughts come in, you're intentionally changing them. So like right away, you want to just say like, they are going to like me. They are going to accept me. I'm going to do great there. I'm very confident. Those affirmations that you constantly tell yourself, that is all about cognitive behavioral therapy and changing those cognitive distortions. The last one is psychotherapy. This is actually one of my favorites because the therapist actually tailors the therapy to the client's needs. And so most therapists, they'll let you know that they're eclectic. Eclectic means that you pull from like cognitive behavioral therapy, or DBT, or motivational interviewing. You will use all of those tools to help the client get through that process. So with anxiety, I understand that cognitive behavioral therapy is the most effective and is evidence-based, but not all the time that is going to actually work for each individual. We are all different. We all have our own ways of dealing with things, our own coping mechanisms. So you want to make sure that you're working with a therapist to make sure that those coping mechanisms work for you. All right, I thank you so much for attending this presentation and learning more about anxiety and trauma and how it all correlates and seeking therapy. If this all resonated with you all, I hope that you can reach out to me or reach out to your therapist by looking at your insurance company list of your in-network therapist, or you can reach out to me at Gracefully Fulfilled Counseling and Coaching Services, or if you want to reach me at Instagram or Facebook, it's Christian, just like the religion, LACHANEA. I hope that this has been impactful and it resonates and it's helpful for you going about your day-to-day journey and addressing your anxiety.